the request to the broken party.
Hello and welcome to the Fitz and Healthy podcast. I am your host, Dr. Lauren Fitzgerald, and today I'm joined by someone super special to my heart because this man single-handedly helped me get back to pre-surgery condition with physical therapy, Dr. Charles Loftis. What's up, my friend?
Not much. How you doing?
I'm doing excellent. Good to see you. So let me do a proper introduction because the fact is that you truly played a huge role. Some people will argue that your role is even more important than the surgeon's. We're not going to get into that.
Yeah.
But the fact is that I am back 110%, and I have you so much to thank because you and your physical therapy post-operatively for like 3 months, single-handedly got me back to where I am today. So you are you have a doctorate of physical therapy, and you have some other letters behind your name.
Correct.
Can you tell the audience what the other letters are so they understand why it's important to listen to you and you actually know what you're talking about?
So the CSCS, I'm Certified Strength and Conditioning Specialist, and that's through the national organization of the NSCA, the National Strength and Conditioning Association. It's considered the gold standard for strength and conditioning coaches. Along with there's one other one as well, the CSCCA, but more so it's one of the top of the line strength and conditioning certifications that you can have, and just very, very comprehensive type of information. So that's one. And then the certified dry needling, the CNDN, is certified dry needling, which you have to take courses through professional organizations that offer those classes and teach them dry needling. And typically it's they're separate from, learning about the upper body and lower body as well. So usually it's either one long weekend of courses or, two separate courses themselves.
All right.
And then the USAW SP is a United States Olympic weightlifting sports performance. So basically the education, learning about Olympic lifts, modified Olympic lifts, and being able to, it's an entry level into being able to educate and coach individuals and athletes in the Olympic lifting world. So,
okay. And so the reason why the listener should care about this is one thing is we usually do a medical episode and a exercise episode. And this episode is going to kind of be covering both because you have your hands on both. And I know on the live broadcast that we did to introduce you to my Facebook fans, I reiterated the fact that not all physical therapists are created equal. And like anything you should do, if you are going to have anything done to you by a medical professional, you should do research. And this is how I found you, because I knew that I didn't just want any physical therapist. I wanted a physical therapist that understood that I had an active lifestyle before, whether people want to admit it or not. I mean, you can vouch for me. I'm an athlete.
Right. No, everyone. I mean, we're all, as humans, we're all athletes. We get that a lot. And, I would hear from just the general population that, oh, I'm not an athlete. No, you're all an athlete in your own respective way. So
right.
Your goal is to get back to doing. Correct.
Exactly. And before my ACL meniscal tear and reconstruction of the ACL using my hamstring tendon, I was teaching 4 times a week. In the gym, lifting weights, strength and conditioning, at least 6 days a week. And I had no doubt that I needed someone who understood the importance of getting back to that status instead of just going through the motions that I've seen so many physical therapists do.
Right.
So let's start off by telling the audience just your little history, because I do think that your history is important to tell them how you got here.
Yes, it's the main reason why I got into this, and exactly like you were saying, I call it bridging that gap from PT to return to functional, return to play. So when I was in 7th grade, I was in a significant car accident And at the time, I mean, I was a pretty tall, frail kid. I mean, I was about 6'3", 6'4" in the 7th grade.
And you're how tall right now?
I'm 6'6". Yeah,
Okay.
I'm 6'6", and I think I'm done.
Okay.
But, you know, and then a little bit more weight on than what I had back then too.
Right.
In a healthier way. But so that I was a very, very athletic individual. I played sports my entire life, and especially at that time was a prime time for that. Being very explosive, very athletic, all over the place, but being very frail, not having the core stability, hip stability, knee stability. After that car accident, which I had a compound fracture, which a compound fracture is basically where the bone punctures through the skin of my right femur. So it snapped, came out of my leg, and you
Talk
know,
about pain. That's one of the most painful things that you can ever go through.
right.
You know.
And then the rehab process was no joke on it as well. They had to go in and do a ORIF, open reduction internal fixation, where they stick a rod basically from my hip down to my knee and pin it in there just to stabilize the femur. And typically they would leave it in there unless they're, after so many years, it becomes an issue, which it did for me. It was grinding in my hip. So it was time for them to remove that. But at that time, when I was going through physical therapy, and again, it's like you said, physical therapists aren't created equal, just like any other profession. In the physical therapy world, especially orthopedics, we typically have a mindset of, okay, get them from point A to point B, and then once they achieved those bare minimum goals, all right, you're discharged from PT, go on about your business.
Exactly.
And that's where that gap is left open, and we need to do better as PTs to advocate to fix that gap and get individuals back to where they need to be. So I was kind of left behind in that standpoint. There weren't any sports performance facilities around in Oklahoma at that time. Now, like there are, and going through sports, playing all the way throughout the high school level, I started developing this weird knee pain in high school, probably my sophomore to junior year,
Okay.
where
Prime year.
Right, where my knee would lock up. And, me not knowing, my coach had no medical background. He didn't know. He's like, oh, it's just growing pain. Just push through it. So the knee would lock up. I would just wiggle my knee side to side, and boom, it would loosen up, and I'm back to business. Well, knowing what I know now, I had a bucket handle tear in my meniscus at that time. So what happens with that bucket handle tear, the meniscus, the flap flips up and gets caught in between the hinge joint, which stops the joint from moving and locks it up a little bit.
Can you explain to the listeners why the meniscus is important and what it does? Because there's a lot of listeners that have kids that are athletes that would easily just, it's just growing pains. So why do parents and individuals need to care about this?
Well, for one, I'll say the meniscus and cartilage, it's the same thing. Meniscus is basically a type of cartilage. And and it's your shock absorber between the femur and the tibia. It's between the thigh bone and the shin bone. So whenever you're doing all the compressive forces, jumping, running, it helps keep the bone from crushing on top of the other bone. And when that cartilage wears out, it has a very, very low blood supply in certain areas, and in some areas it lacks blood. So therefore, it doesn't really regenerate. I think now a lot of doctors and with the science, they're starting to do a little bit more of the meniscal repairs. But back then, it was just typically once it was, disfigured, it was a meniscectomy where they go and just, hey, let's shave it down, remove it out, and wish you the best, basically.
Exactly.
So that's why it's important. The meniscus is a really important part of the body to help preserve the knees, to keep the arthritis from happening, the arthritis stage from happening as an early stage. So
knowing what you know now, if you had someone like you in your life, what would you have advised the younger version of you to do at that point?
After physical therapy, go into a good preventative care or strength and conditioning program to learn not only how to run properly, because that's one of the major keys is running actually is an art. It's a technique. And a lot of people don't realize everyone is not built to run. And
Huh.
I'm sad to say everyone's not built to run, because there is a certain
I'm not.
an art to it. And I mean, it's like Newton's law. I believe it's 3 for every reaction. There's an equal and opposite reaction. So if I use this analogy a lot to a lot of my clients, if I'm putting 100 to 200 pounds of force into the ground, you're going to get that equal and opposite force right back into your body and the joints.
Right.
So that's one thing. But jumping plyometrics, not only form and technique, but how to control and land not only in one plane, but in multiple planes at that too. You got to have that good braking mechanism on how to absorb that fall, that land, and save your joints from that standpoint. So it's the same as running. So learning acceleration to deceleration techniques, strengthening the hips, the knees, working on mobility. A lot of individuals are just, immobile, hips, knees,
Right.
a lot of ankles, which also influence the way we move and the way we have our movement patterns. So
I know that you don't just work with basketball players, but I know that you work with basketball players anywhere from the high school level or even younger than that,
right,
to professional.
Correct.
So let's take the traditional young athlete, especially someone that has enough athletic ability, because I'm sure that your mama was like, "Oh, Charles is gonna grow up and be a professional NBA player, right?"
Yeah, I thought that too.
yeah, especially with your height and skill, right? But what are some steps that you can start off early with your young athletes that are doing athletic stuff more than just extracurricular?
Well, starting at a really early age.
Like how early?
I want to throw this out. I mean, you could start them very young. There used to be a big, I will call it contraindication or a conflict because of the whole growth spurt and the plate type of deal.
Yeah, yeah.
Can't start doing anything until they hit, puberty and mature on.
Right.
And that used to be the way that it was thought about in the medical world. But now research has basically null and void all of that and just, thrown it out the window. I mean, you can get them started at a very early age, but appropriately is the key, so dosing it and prescribing the right exercises, the right load. It may just be body weight type stuff. It might be using a what we call a dowel rod, just a wooden stick or a PVC pipe, but teaching them and reinforcing movement patterns that we actually, as babies, know at a very early age, like their primitive reflexes.
Right.
I don't know if you've ever watched a baby. They actually have the best squatting form there is.
I was about to say, you're about to say squat, because I can tell.
They have the best squatting form that there is, but it's reinforcing those movement patterns as they get older and continue those movement patterns. That way, when they do get to a certain age, they don't have limitations and restrictions like mobility issues that hinder those movement patterns,
right?
Unless they hit a huge growth spurt and their bones grow much quicker than their muscles. Is at that point in time, what happens is the muscles are having a hard time catching up. So something from the height, something has to give and then sacrifice, and typically it's a flexibility issue. So,
okay.
But yeah, we start with them early, and it's the thing is fundamentals. First 3 letters FUN. So we want to make sure that it's fun to them and it's not competitive to them.
Right.
So giving them that nature of, hey, let's just have fun, just run, go down, touch the wall, come back, go pick up this ball, throw it in the bucket and come back. It's teaching them how to position their body appropriately from taking off to getting ready to change directions. But they don't know it. To them, they're like, oh, I'm just having fun, picking up a ball, running and throwing it in this bucket. And, setting against measures against, let's see how fast you can do it, or, and so on. But that's the first key, getting them started early. There's a popular strength coach, last name Durant, out in California, Laverne University, I believe.
Okay.
Are you familiar? Okay.
No,
and so he has a son that is Olympic lifting, and his form is better than many of the, he Olympic lifts at a very early age.
Wow.
Of course, he's using a more of a training bar, but as he's maturing, he's being able to throw a little bit more load onto that training bar. But he taught him at an early age, and he's keeping those same movement patterns and just reinforcing that. So it's very safe to get him started at an early age.
Okay, so I can already hear some of the parents that are like, well, I could just do those little fun drills with my kid. What's the benefit of having someone like you that has the professional training, the letters behind their name? And then also, how often should you do? Like you obviously have a kid that's super athletic and you want to get them in right away because you know that they're going to do something with their athletic skill.
Yeah.
How often?
Let's start with the reason why it's more so better to have a professional do it compared to just the average parent. Is
because you can YouTube anything, right?
You can YouTube anything. The internet is a blessing and a curse at the same
time. It is.
But it's the eye, the strength coaches, the professional, it's the eye that they have, and being able to look like, well, on this land, their knee goes into a valgus 4, so we need to correct that. Well, how do you correct that? Given the proper progressions and the regressions as well. So that's one of the most important things is the knowledge standpoint and having that eye to be able to fix the situation or be able to identify a situation and be able to fix it immediately.
Right.
That's one. And what was the other? The frequency?
Yeah.
It depends. It really depends. There's a difference.
Like if money wasn't an issue.
And not even thinking about money. I mean, there's a difference between chronological age and training age. For an example, my youth class, which is typically 5th graders and up, I have a 2nd grader in there right now.
Cool.
And the 2nd grader is, much more mature and
because he's keeping up with the older kids.
He looks beautiful. The stuff that awesome. He does, and I post him on social media, and people are like, "Oh my gosh, that kid!" Like, they think he's the cutest thing, and want him in this and that. But so him being pretty advanced, I mean, he can go more frequent than those that are not. But I mean, at least 2 times a week, up to 3 times a week, depending on the season. If they're not in school and they're able to make it and so on. But yeah, somewhere between 2 to 3 times a week for sure would be ideal. Okay. And, I have some parents that say, well, what does 1 time a week, if we can only make it 1 time a week, 6 in one hand, half a dozen in the other, it just depends. But I think doing something and learning something is a little bit better than nothing at all.
Right.
So, if that's all we can work with, then yeah, we would go with that route. And at least him 1 time a week, but so about 2 to 3 times.
I'm sure that you've thought about this. Do you think that if you would have been into strength and conditioning before the accident, because obviously, I mean, there's no way to tell if anything would have changed if you would have had strength and conditioning before, and your musculature would have been better supporting your lower extremities. But do you ever think about that? The what if?
Oh yeah, I think about it all the time. But it's the nature of the beast when it comes to sports. It is what it is. But I'm able to take my experience and apply it to life and help all those others around me and that are needing it and just don't know. I think Oklahoma, for one, this market, we're way behind many other states. But it's starting to slowly develop and mature. So we have to be a huge advocate for that here and get the parents to understand why that, every parent wants to be, the fame for their child, and they don't trust other people, with them. But it's I won't say it's it's a pretty bad way to think, because
absolutely
you take away from that kids' experience and you could limit them, to a certain extent. But so yeah, I mean, I think about it all the time, the what ifs, if I had this, if I had that, but we can't go back in time. So it's about how do you move on forward from that and take your experience and turn lemons into lemonade.
Right. Because your car accident, I mean, it was an injury nonetheless, no matter if the injury happened on the basketball court or in a car accident. Your body had mechanical injury to it. Right. And now we're talking about, how to prevent, because for the listeners that don't know, I think you know this, but I was in a major car accident. Mm-hmm. I was hit by a guy I was taking a protected left, and this guy just wasn't watching on the Pacific Coast Highway and just hit me hard. And I walked away from that, and I have no doubt that I walked away from that without any injuries, minor details, but for the most part, no major injuries, because I have been strength and conditioning my body, and it was able to withstand the impact from that car. And plus, I had a good car. That I'm going to give shout out to my well-made car. Yeah. But I have no doubt that helped prevent some injuries that if I were just a frail 38-year-old that didn't have muscles and you know, the strength and conditioning that I've already had, I probably would be debilitated in, you know, short term or even long term.
Right. Because of the mechanical stress that you have always put on your body. So that's what bone actually, you know, it adapts to that. So your bone density is probably, you know, really good. And
you know how strong I am.
Yeah, I know how strong you are. Definitely, especially those push-ups.
That's right.
No, for sure. Yeah, I mean, I would say that could possibly, you know, play a key into that in the way you came out of that accident. Yeah, I saw the pictures of it, and it's a pretty significant accident, you know. So.
Absolutely. Okay, what are differences that you see between your male clients and patients versus your female clients and patients?
Ooh, I would say for one, mindset.
Really?
I would say one thing, it could be a mindset.
Okay.
You know, a lot of times some of the men are a little bit, you know, more babies than the women.
No.
Yeah. I mean, it's a thing where a lot of the guys, they have this mindset that they know it all, you know, or they've done this, been there, done this, and they know how to handle this, where, you know, the women are a little bit more open. I would say. So that's one thing. But then on the flip side, men typically their body's a little bit more, you know, I would say matures quicker.
Okay.
Than some of the
strength-wise.
Strength-wise, right? Strength-wise and coordination-wise, yes, yeah. Because there's a timing, especially when it comes to jumping. You know, with the non-contact ACL injuries, typically from it either occurs from a cut, like a plant and cut, or a jump and a land. But it's the timing sequence in that what we call the point of no return, where your center of mass gets out of position and your knee is in a vulnerable spot and can't control that center of mass anymore. I'm not saying that the guys don't sometimes go into those mechanical problems, but the timing that it happens, you know, the women's a little bit more delayed than the men. So those are some of the things. Also, women are typically upper body, you know, insufficient, strength-wise. So there's a huge, I see a huge discrepancy in that from the male population and female population. And on the flip side, women, their lower body typically is a lot more developed or stronger than some of the men. That's just because of, I think one is the mindset that, you know, women they love to work out their hiney, their hips and everything, and because they want their legs.
Did you say hiney?
Yeah.
I love that you're like, I don't know if I can say anything else.
No.
We do like to work out our hiney for sure.
You know, and so, you know, from that standpoint, and another thing, a lot of women, they have this mindset of looking like a man because they have tone and definition upper body wise, and it's like, no, you don't look like a man, you just look very athletic or well defined. So exactly. Yeah, those are some of the differences in between the male and female clients that I have.
One of the questions that I remember from someone who left a comment, Kate, she asked specifically about young female soccer players, and I know that is a stereotypical ACL injury waiting to happen.
It is, yeah.
So is there anything that you do special for that population? You have a client that you know is a female, a client / patient, because you do both, that is a soccer player. She has athletic potential. She might go on play professional. Is there anything that you're going to do to try and help prevent an ACL injury that's specific for a female that's a soccer player?
For sure. First, I mean, it will start off with, you know, different assessments. from a jump assessment, jump to land assessment, and see how they handle that. And then from just your basic jump to land, and maybe throwing in some directional turns with those jumping to landing in a different planes, and see how they handle that. And then some other functional assessments that I would go through just to see how well maybe their hip or knee stability may be.
Okay.
And then from there, I'm able to basically, decide what's best for this person and their discrepancies or deficiencies that they may have, whether it's strengthening up the hips, working on core strength, again, learning how to plant and cut and change direction, position your body at certain angles, because that's typically what happens is that, they go run, and they want to cut this way or plant, and then boom, the knee just gives out because it's just in a vulnerable position to injury. So
right.
yeah, that's where we would go in it, but it's a really common type of format that I would go with, not only just the female population, it's guys as well, but I think with that certain population, especially the female soccer player, it's a little bit more aggressive.
Yes.
Than the others. So
for sure. And I mean, just hearing you talk about that makes me think of the mechanism of injury when I tore my ACL. Like, I don't know if you remember stepping on the edge of the stage and just, I feel like if I would have been specifically targeting some different exercises with strength and conditioning, I feel like that injury, I could have compensated and not hurt my knee and not fall off the freaking stage.
Yeah.
And tore my ACL.
Yeah, and some things are inevitable, So there is.
You're right.
In the sports and the medicine world, the term injury prevention, and I used to use that term all the time.
Yeah. But
then I heard another strength coach that I look up to and mentor through. He described everything and said, if it's going to happen, it's going to happen. We can't prevent anything. So changing that term up to more so injury reduction type programs are, that's the way I look at it now, to try to reduce amount of injuries as much as possible, because if it's going to happen, it's going to happen. And with me saying that, I had a client when I used to work at my other job as a physical therapist, that this guy was a bodybuilder.
Okay.
And pretty short guy, stocky, muscular, everything that you can think of. Came in ACL reconstruction, and he tore it by going to a Thunder game, and he was just simply stepping over a row and pushed down on a seat, and boom, tore his ACL. And this guy had been back squatting 500, 600 plus pounds and doing all these extra things. And it took something as simple as that tore his ACL. Seriously.
Wow.
So that's a perfect example of it. If it's going to happen, it's going to happen.
Right. Well, and just brute strength can't prevent injuries like that. Because I mean, I was super strong when my injury happened, and I mean, I was able to squat a ton and whatnot, but but
it took something so minuscule to do that. But there's also anatomy structures too that are into play, like the notch that the ACL lies into. If it's a narrow notch, most research has contributed that those with more of a narrow notch have more ACL injuries because the ACL just doesn't have a lot of room to play and support in there. So,
but that's not something until after your orthopedic surgeon's been inside and looked and like, oh, yep, they've got a narrow notch.
With this study that I saw, I think they did some type of X-ray or MRI, and they were looking at that, through individuals. So, but it's just still, you're not going to be able to go in and say, hey, I want to look to see if my notch is narrow, or if it's you're not going to be able to get any images or anything like that from that.
Right.
Yeah, it's something that you won't find out until after the injury happens.
Now let's speak to because obviously there's a lot of parents that listen to the show, but there's a lot of people that are like, well, just what about me, myself and I as an adult? Because, if you're, I would say a majority of my listeners are not professional athletes. They're active parents. Some are doing at-home workouts. Some are working out at the gym. Some are doing, they're active. Or they're getting into a phase that they're starting to have an active lifestyle. So what would a role of someone like you help someone like the average listener?
get a good understanding of your body,
Okay.
what you can and cannot do, how well you move or how well you do not move.
Okay.
Those are the keys. So like I have an adult fitness program that we've started here. And we have clients that come in right now. The class is like 3 times a week. We're working on trying to bump it to 4 times a week. But we made this, created this facility for all different ages to come in, not just for those that are professional athletes or they're aspiring to be professional athletes. It's just general, fitness type of program, but with well guidance. So
you're not just a personal trainer. I want people to understand that.
I'm not. Yeah, I'm not a personal trainer.
Not that there's anything wrong with people that just have a personal training license, for sure.
But I think there's a huge difference between the two, especially with the certifications. There's
Absolutely.
a huge difference from the testing and the education standpoint. So yeah, I'm not much. I do some personal training. I do one-on-one coaching or training with different clients or individuals that are able to. But no, yeah. So.
You're actually in your facility. So I want to give shout out to you and your facility, because that facility, you were just talking about opening your own business when you were treating me in my post-op period. And that you're there in Edmond, Oklahoma. The facility that, for the people that watch, you can see your facility behind you. I actually came and trained with you a few times. You kicked my tail, my hiney, if you will. But it was definitely not only, I mean, it was a great workout, but there was definitely, it was a different kind of workout. So
it's a different environment.
For sure. So someone like me who is active, if I had access to you, how often do you think that I should come see you and train with you? And do you think it's something that needs to be on a weekly basis, monthly, or maybe check in once a year? Like, what do you recommend? Because like my activity level.
Right. Now, again, it varies. Now, if we're talking about your activity level, you're one that you understand movement patterns, how to lift correctly. So it could be more of a maintenance program type thing for you. Like, hey, Charles, I just want to come in like once every so often just to kind of do a what we call this a check, our maintenance type program, just to make sure that I'm doing this appropriately and so on, and not causing more harm to myself. And then also to add in maybe some additional stretches, mobility, corrective exercise type deals. So it could be something as, once a week, once every other week, or something of that nature. Now, someone that really needs to learn or, re-educate their body, then yeah, you need to come more frequent than not at all. So at least 3 times a week is what I would look at. And again, based off of their work schedule, if it's 2 times a week, then great. But, somewhere around that 2 to 3 times a week. And then once you get into a groove and build up your stamina, your endurance, strength, then boom, maybe we can go forward at that point in time.
Okay.
And continue on for, as much as you can tolerate. But, one thing here too, the foundation that I have is I want to create a good community for people to come in. The vibe here is just different. If you could, see some of the high school classes and then the adult classes, everyone gets along, they help each other out, they're patting each other on the back. So it's a more of a community type deal.
Absolutely.
But I want everyone to learn.
Yeah.
I want them to feel confident to be able to go to a gym and know what exercises, especially free weights. And that's another thing. Everything here is free weights,
right.
Machine weights. And that's because of machine weights are more so isolated type exercises. I'm not saying that it's a bad thing. I think they have their time and place for, training levels to injury recovering and so on. But, we want to get things as more freedom and functional as possible. So that's why everything is more so free weights. So, but getting the individuals to be able to come in and look at the barbell, the squat rack, and say, I'm confident with that. I know what to do. My form is good. My coach helped me out with the technique, and I know how to brace my abdominal pressure and keep my spine in neutral.
I know how to squat like a newborn.
Right. Yeah. So, so that's one of the biggest things here is getting everyone, letting people learn, teaching them and allowing them to be able to have a better understanding on what they're doing and feel confident to be able to possibly go to the gym, work out, mainly themselves, and then come back over here like once every so often, and just for the community standpoint. So
I would also like to hear your thoughts on the people that have an injury, that the injury may or may not necessitate surgery, and how soon do you feel like they should be coming to someone like you, a physical therapist who also has this background?
it depends if it's someone that's trying to not go the surgery route, is that what you're saying? If they're not trying to go the surgery route, for one, it depends on the nature of the injury,
Right.
But as soon as possible,
Yeah.
if it's okay and the doctor clears and they're like, let's not really, let's take the conservative route and maybe not go straight to cutting and see if we can help build around this, then yeah, as soon as possible. But if it's causing issues, continue to cause some issues, and we can't get through, like a month worth of training, maybe, 2 to 3 times a week at that point in time, then yeah, we'll kick back to the doctor and say, this isn't working. We need to look at, a different option. But
how often do you see physical therapy help prevent surgery, percent wise? I mean, is it?
Yeah, I mean, I not much. Most of the injuries that when they happen, they happen.
Yeah.
They're pretty significant injuries.
I know. I think about how many people I've met that are like, yeah, I don't have an ACL. And I try and imagine me not having surgery and carrying on with life at the same level without an ACL. And I don't know if that was even possible. I mean, I never even thought about that possibility, Yeah,
it depends on the stability of the knee. And the ACL is not the only structure in there that's helping stabilize the knee. The ACL and the PCL, there are other structures around just the muscular, the tendons, the quads, the hamstring tendons, and so on, that help stabilize the knee. So it really depends on the strength that these individuals have, and also the muscle density that they have too around those areas to help stabilize that. But also too depends on what they're doing, and if it's someone that's a very elite high level and they require a ton of cutting, planting, and this and that, then yeah, possibly you need to go and have that surgery. Just go ahead and get a reconstruction to help stabilize the knee a little bit more. But if it's someone that they're not that active and they're very comfortable with their lifestyle and what they're doing and able to still exercise to a certain extent and maintain, and it's not bothering them, then yeah, I have heard of that before. There was a NBA player that I think he played for the Spurs when he first got drafted. Bigger guy, about 6'8", 6'9", thick kid. He played for Pittsburgh. Okay. And it hurt his draft. It hurt his draft numbers because, going through those physicals, they knew that he didn't have ACLs in his knee. So therefore, a lot of people didn't want to take chances on that. But he actually when he got drafted, he had a really good, rookie season, and, a couple of seasons after that. I don't know what's happened to him now, if he just, shut it down or what, but yeah, so I've heard of that before, of people not having a ACL and they continue on with life just fine.
Well, what about, so I had the nicety of being able to literally, I had my knee injury the 14th of December, and then I had my surgery a week later. That's usually not typical. Usually people have to wait a good span of a week, sometimes even months before their surgery. Is there any benefit to getting into someone like you to build up to surgery so that their musculature can be maximized, if you will, or optimized, I guess?
Yeah, for sure. A lot of times the surgeons, if it's a significant surgery, they try to get them in as soon as possible. And I know their schedules are, pretty busy depending on the market that you're in.
Right.
Yeah, we do pre-op physical therapy. And it's not only to strengthen around the areas, but to keep the range of motion. That's what's key. So if someone that has, a ACL injury or, meniscus tear, and either the swelling inside the knee, or they become very muscular guarded, and they lose that range of motion, then it's our job as a physical therapist to help try to increase that range of motion or maintain what they do have at that point in time. Right. As well as strengthen some of the muscles around, like the quads, the hips, and so on, because the body does, it's a magnificent thing the way, our body is set up, and it's a protective mechanism. So certain things after injury, they shut down to prevent you from going and continue to do things that could potentially harm you even more.
Right.
So the way the body is lined up to be. So when that atrophy, what we call atrophy, where the muscle shuts down and basically goes dormant, when that sets in, our job is pre-op, like, hey, let's try to get the muscle to fire up before we go into surgery, because we know atrophy is going to set in after surgery.
Mm-hmm.
So, yeah.
Do you remember my right booty cheek?
Oh.
I remember I was standing in line at this event, and I was holding my crutches, and I just happened to put my hands on my hiney, and I remember feeling like, oh my gosh, my right hiney cheek is no longer there. It was much smaller. Atrophy had set in, and it doesn't take long to set in either post-op.
No, it doesn't take long at all. It doesn't take long, but sometimes it can take a very long time for it to come back. I compare it to like grade school, like GPAs,
Yeah.
To get that GPA to, flunk out and drop down. But it's like, hey, I got a 2.0 and I need to bump it up to get like a 3. That's going to it takes a lot of time. So sometimes that's the way the body works as well. I have a client now that she has had knee surgery, and it's a routine knee surgery. It's just a real minor cleanup.
Right.
But the body responded to it in a negative manner. And so she kind of locked up and guarded around the knee area. But her quad it's still, she's months post-op, and we're still working on trying to get her quads to fire up. I do that.
No way.
Oh, yeah. So I have a neuromuscular electrical stem. I'm putting it on the quads, and I'm throwing that, high current in there to just get it.
I remember
that like strong contraction. Yeah, same thing for you that we did too.
Yeah.
It's slowly coming back, but sometimes it has a mind of its own and just does its thing. So
absolutely. Yeah. So if someone wants to find you specifically online, where should they go?
I have a webpage, www.XCEL fitness, all one word, .training. It's not a .com, it's a .training.
Okay.
That's my webpage. And then my social media on Instagram is Excel Performance, all one word.
And that's XCEL, guys.
XCEL, right. XCEL.
Yes. Look at that shirt.
And then I have my public figure page and my personal page, which is doc_Loftis, Loftis. I'm also on Facebook, Charles Loftis as my personal, then also the business page, Excel Performance and Fitness, all, the entire name of the company. So, and
I follow all of those, and you have different resources on all of them that are really good for people. If someone that didn't live in Oklahoma wanted to just have a consultation with you, would that be something that they would have an option?
Oh yeah, for sure. They can contact me on the web page, which also the website has all the other information too. I just stated they can go there and send me an email. Go to one of the social media pages and DM me, send a message, email also.
Okay.
I do that as well. I have a doctor out in North Carolina right now that he has a 13-year-old son that's maturing and growing fast, but we've done some video Skyping assessments. Typical thing. I really, it's one of those things that I don't really prescribe online programs because I love to keep progress and make sure that my clients are doing what they need to do the right way, because it's really easy to screw up.
Right. Well, like you said, it's the eye. It's the ability to see your clients and your patients doing what they're doing, because if they're having bad form, that's everything.
Yeah. And I cannot live and allow myself to live and go on and be like, all right, well, yep, go ahead and do this. And
I've sold the program. Yeah.
Right, sold the program. Right. No, that's not what I'm about. I want quality. So, but people can reach out to me just for consult if they're trying to find like, hey, recommendations for a physical therapist, what to look for in a physical therapist. They have certain type of procedure coming up and they, want to know like, well, should I do a, ACL bone, tendon, bone, or should I do, hamstring, or, should I do a allograft, go ahead and do a cadaver graft or something of that nature.
Right.
Yeah.
So also one other question that I had is that If someone like me wants to come see you or maybe even fly you out, is that an option?
Oh yeah. Oh yeah.
Okay.
Definitely.
Okay.
I'm always
I'm just
down to
thinking
go tour
because
other places, and right now I'm getting ready to pick up in my traveling just for continuing ed, the Con Ed stuff, and going to NBA Strength and Conditioning Coaches Association coming up, and in a
is
couple.
there any organization that is for people like you that have both your physical therapy license but also strength and conditioning and all of the things that you have, like
Just like standalone organization?
Yeah.
Yeah, no, there's
No,
not.
maybe you should create one.
I know, right. You just gave me an idea.
Right?
No,
Hey,
not
continue with that
standalone
later.
organizations for that. Right. I'll have to write that down and
But
kind
no, seriously, I mean,
No,
to have a resource of, where people could go and look for, because you have such a unique ability, and that's, I mean, if I, knock on wood, hopefully never need surgery again, but if I do, I want someone specifically like you so I can visit you before, perioperatively, and postoperatively.
Right. For sure. There are different organizations like the the NSCA, where my CSCS is. There are different people in there that are also PTs as well. So you can go to like their websites and just look for
Okay.
strength and conditioning specialists that may have, PT initials. LinkedIn is a great resource to find physical
Okay.
therapists in your area, and looking for those initials as well.
All
And
I
then also,
know, I see it in the future, the FITz Academy, where
that'll be dope. And I mean, I've this past summer, I teamed up with one of my buddies that's a big celebrity trainer out in
LA, right?
Atlanta.
Atlanta. Oh,
Right,
opposite coast.
No, Guru of Abs, Deshaun. He goes by Guru of Abs, and
Okay.
he's a body sculpting type of trainer. Program is completely different than mine, but we came together and did this hybrid approach where, hey, mix the strength and conditioning, and boom, after that we're going to go into your sculpt. And it was a different, unique thing. It was actually different. He's been doing this for a long time, and I just talked to him yesterday. He was like, man, I'm still like in awe of the time that I came there, because when he goes to different places that bring him out to run group sessions together, he said this one was completely different than what he's typically seen.
Why am I not surprised?
Yeah, but there's always possibilities. I would love to do that and go out and start, just spreading the word, spreading the love out in different places, and just meeting new people as well too, and building those connections and ties.
Absolutely. Well,
there too.
I know that you've heard this a million times out of my mouth, but I have to say it again. I appreciate you so much.
No.
And I thank you. Oh man, you truly, you not only, helped me physically, but mentally. You were you became a friend during that period of time, and you stayed a friend. I consider you a friend of mine now. And I appreciate your heart, your hard work, your work ethic, your just true desire to really help people and use your God-given talents and your experiences in life to help other people. Yeah. So
no problem.
Kudos to you.
A lot of the hard work goes to yourself, just for the compliance for one, and the dedication to stick to it, because a lot of people fall through the crack, once you started, and they're just like, oh, I got to get up and go here. I don't, and it's taken out of my day. And well, your own health is very important. So it's great for individuals to think about yourself first. It's easy for us to start getting consumed in life, bills, work, other people's health, and neglect our own health.
Absolutely.
But I do want to touch on this, and a lot of people, your followers, they know and how passionate you are about stuff. Lauren was always, her appointments were early in the morning, 7 a.m. And here I come walking in the doors, and she's already on an elliptical. And it was like that every single time. It was clockwork. Every single time, clockwork. That, so that's why I said, you have to really give yourself a lot of the credit, because, as a PT, a lot of times we're just educators, and that's
right.
Education is more important than, hey, doing this and doing that a lot of times. So it's being able to contain an individual, keep them, in this confined area, making sure they don't go out of their limits, although their body may feel like it, but we still want to keep you here. Or it's about patting them on the back, giving them a little bit positive reinforcement, that constructive feedback, and motivating them to be able to do a lot more, and saying, hey, you got this, you can do this, and you're doing just fine. And, everything that you're going through is normal stuff. So don't fret, but no, that's just I think it's the personality and your love for the health and wellness, which of course your followers already, knew that you have, but I think that just puts the icing on the cake for sure. So it made my job.
Saying that.
It really helps us out, as physical therapists or healthcare professionals to have those motivated individuals. So
for sure. Well, I appreciate your time that you took out of because you are a business owner, and you've got your business behind you, and I know that you have some clients coming in shortly. So I thank you for your time, your expertise, and everything that you've done in my life and other people's life. And we end every single episode by letting the listener know that you are a good person and you deserve good things to happen to you. So we thank everyone for listening to this episode of the Fitz and Healthy podcast. And I thank you, Charles, for being with me this morning.
Thanks, Lauren.
Make sure that you find us on social media. You can find Cinthanie on Instagram and Facebook at Cinthanie. So that's CINTHANIE, and on Snapchat at Cinthanie P. And find me on social media platforms like Instagram, Facebook, and Twitter, all at Club Fitz Fitness. Remember, that's FITZ Fitness. And on Snapchat, just at Club Fitz. I appreciate your time listening so much. If you enjoyed this episode of the Fitz and Healthy podcast, can you please go do me a favor and go subscribe at whatever platform that it is that you listen to podcasts. Leave a review. We read every single review, and we appreciate the time that you take to leave your thoughts and opinions. Now, also remember, while I am a medical doctor, the information I provide here is not intended to provide medical advice or a professional diagnosis, opinion, treatment, or services to you or to any other individual. I am providing general information for educational and informational purposes only, and it is not a substitute for medical or professional care. You should not use this information in place of a visit, call, consultation, or the advice of your physician or other healthcare provider. The information I share is not intended to treat, cure, or diagnose any disease or medical condition. If you believe you have a medical emergency, just call 911 immediately or your physician. Now, enough of that medical legal jargon. Thank you so much for listening to this podcast. I appreciate your time. Now, go live a Fitz and Healthy life.